Preganglionic, short, it's slightly myelinated. Postganglionic is long and has no myelin at all. Targets are smooth muscle, cardiac muscle, and the glands. Just reminding you where we are as we continue on, because now we'll talk specifically about those neurotransmitters. The preganglionic puts out acetylcholine. I thought I had fixed that. I did not. We'll call it postsynaptic. Trying to make it more clear. All right, the preganglionic neuron puts out acetylcholine. The receptor, it's on the postganglionic neuron. That receptor is nicotinic. Oh, I remember something else that needs to go up there. Okay, let me keep talking though. So it's putting out acetylcholine onto a nicotinic receptor. Is that going to be inhibitory or excitatory?
Excitatory.
Excitatory, always. The thing I forgot to do was, I don't know if y'all can see this, the CNS origin. Dorsal horn, ventral horn, lateral horn, roll. Ooh, I don't know if you can see that, cranial nerves. Cranial nerve nuclei is what I should say. There we go. So when it comes to somatic, tell me real quick, where is the CNS origin for somatic? Ventral, right, it's coming out of the ventral horn. All right, for sympathetic, it's coming out of the lateral horn. So lateral horn, lightly myelinated, acetylcholine, nicotinic receptor, always excitatory. Now then, the postganglionic neuron is going to put out epi-norepi. Postganglionic neuron is long, has no myelin, and it puts out either epinephrine or norepinephrine. Now, if we're talking about the actual neuron, postganglionic neuron, it's mostly putting out norepinephrine. If we're talking about the adrenal medulla, it's mostly putting out epinephrine. Puts out a little more, but mostly epi. So that's why I just do the epi-norepi. With the neuron itself, the ones that we saw with this anatomy, these neurons that are coming out of the ganglia, these are mostly putting out norepinephrine, some epi, but mostly nor. But if it's the adrenal medulla, it's mostly epinephrine. All right, and then the receptors, they're going to be adrenergic. And it will be the alpha and the beta is how they are named. Alpha 1, alpha 2, beta 1, beta 2, beta 3. Now here are the catecholamines. That is, these are the neurotransmitters. Notice they start with a tyrosine base. We add a hydroxy and we get dopa. We add a hydrogen instead of the carboxyl group, we get dopamine. And then we have norepi and epi. So we take dopamine, we substitute a hydroxy instead of a hydrogen to get norepinephrine. And then to get epinephrine, we substitute a methyl group instead of that hydrogen. The reason for this was just to show you how closely related they are. Chemically, they are very closely related. Now, and I don't have a slide for this, though we talked about it, it was part of chapter 7. These are broken down with monoamine oxidase. So norepinephrine is sucked back up, in the case of the neuron, broken down with monoamine oxidase. If we're talking about in the blood, epinephrine is going to have to be broken down by the liver. And it's also going to use monoamine oxidase. Break that down. So that's a thing to know because we talked about that as far as drugs go. If someone's on a monoamine oxidase inhibitor, that means that they have a higher circulating level of norepinephrine. And then if you give them drugs that cause increased norepinephrine or certain foods that are rich in tyrosine, they will have a catastrophic fight or flight response. They will have a spike in norepinephrine, which could kill them. So that's why if they're on an MAO inhibitor, they need to know they have to avoid foods that are rich in tyrosine, which are the aged fermented foods. Red wine, aged cheese, oddly enough, fava beans, chocolate. So then there are medications that interact with that. Since I have that up there, it's like, well, if it's rich in tyrosine, they can't have it. If they're on and they're on an MAO inhibitor if they have depression. That's how they're treated, what they're being treated for. All right, from another book, sympathetic versus parasympathetic. So the neurotransmitter being released from the postganglionic neurons, norepinephrine with the epinephrine. They're adrenergic. They are broken down by monoamine oxidase. The receptors then, adrenergic if we're talking about postganglionic, cholinergic, nicotinic if we're talking about preganglionic. Now here's the adrenergic receptors effects. This is from your book, where we're looking at the specific adrenergic receptors, alpha 1, alpha 2, beta 1, beta 2, beta 3. But that's not good enough for you, because you're going to be nurses. There are a lot of drugs that affect the neurotransmitters at this level, so you have to know which receptors on which tissue. And then you have to know, is it inhibitory or is it excitatory? I don't know, are we keeping this, or can I put this in trash? Okay.
You actually save them.
When I was in nursing school, the vending machine put out Planters peanuts, and you saved the wrappers and turned them in, and then you got, like, because I have it all, the Mr. Peanuts bank, the Mr. Peanuts stuffed doll, the Mr. Peanuts tote bag. You got a lot of Mr. Peanuts bling for saving the peanut bags.
Nice.
All right, so what I did is I went over to the bookstore and I borrowed nursing pharmacology book. And then I replicated, with some modification to make it more clear for you, I replicated what was in there as far as what these different receptors do. So the alpha receptors, alpha 1 receptor, is found on the smooth muscle around the blood vessels. When activated with epi or norepi, it causes the smooth muscles to constrict and it raises blood pressure. Alpha 1 receptors are on the heart muscle itself. When epi-norepi binds to the alpha 1 receptor on the heart, it increases contractility, which increases the amount of blood being pumped out. They are also, alpha 1 receptors are also in the smooth muscles of the iris. And when stimulated with epi-norepi or an agonist, we haven't talked about those yet, it causes those smooth muscles to relax. Not constrict, relax. People wear glasses, you get your eyes dilated? Yep, so you're getting an epi-norepi agonist that's binding to alpha 1 receptors and causing the smooth muscles in your iris to relax. It causes your bladder to contract as it does the prostate as well. And we'll talk more about the complementary effects there. Okay, and then we look at the alpha 2 receptors. Now the alpha 2 receptors are interesting because there are alpha 2 receptors in the brain that when they sense the rise in norepinephrine, they decrease innervation to those blood vessels and cause them to relax. It's almost like, okay, yeah, we want to run from the bear, but we don't want to pop an aneurysm while we're running. So it kind of modulates it. I make this point because there are drugs to treat high blood pressure that are alpha 2 agonists. They bind to alpha 2 receptors and they will cause relaxation. Now notice what happens in the smooth muscle around the gut. It relaxes the smooth muscle around the gut because we don't need to digest a sandwich when we're running from the bear. All right, now let's look at the betas. The beta 1 receptors. They are on the heart muscle where they increase heart contraction. They are also on the heart pacemaker, so they increase heart rate. Again, remember thinking about we're doing all these things to run from the bear. Beta-1 receptors are in the kidney. Now, we haven't talked about these hormones yet, but what they do is they're going to increase blood pressure. These hormones from the kidney increase blood pressure. Beta-2 receptors. They're on the smooth muscle around the gut also. We're going to relax the gut. They are on the smooth muscle around the bronchioles. We're going to relax those. We're going to inhibit those too, because we need more air, more oxygen to run from the bear, so we dilate. Anyone who is an asthmatic, you are familiar with albuterol, possibly. Could be what you're inhaling. Those bind to the beta-2 receptors and cause your airways to relax so you can get more air. All right, we do not need to be given birth while we're running from the bear, so it causes the uterus to relax. And then we need more glucose. So there are beta-2 receptors in the liver that will start breaking down glycogen, so we have more glucose. So we had to go at this level because there are medications that are at this level specifically affect alpha-1 receptors or beta-2 receptors. And that's why we have to be this detailed. Now, the beta-3 receptors are on adipose tissue, and they cause fat to start getting broken down, triglycerides, broken down to release fatty acids into the blood to be used for energy. Exercising skeletal muscles prefer fatty acids as their primary source of energy. So that's what the beta-3 receptors do. I don't have that on there because there are no drugs. I don't have drugs that are affecting those. The issue here was because you're going to be giving drugs one day, you need to know what these receptor binding twos do.